Welcome to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And today I have my co-host, Dr. Angel Lazo.
Hi everyone, my name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place. And today we got a special treat because we have not one but two guests today.
I know.
Two cardiology guests, Dr. Kothari and actually Dr. Katz.
Very exciting. Dr. Kothari and Dr. Katz are some of our newest cardiologists. Hudson County and Jersey City Medical Center, exceptional cardiologists with a passion for preventative health and really treating people across the spectrum. So it's going to be really great to hear from them.
I'm really excited to talk to them actually because as an internal medicine doctor, I have a very strong rapport, especially with cardiology, but especially the clinical cardiologists, and this is part of their structural health program, their cardiology service line that they have everything from clinical cardiologists, invasive cardiologists, so it's just incredible what they offer here at RWJ Barnabas Health at Jersey City Medical Center.
So while as an emergency physician, I often see people too late for preventative, we're very excited that we have this access for our cardiologists. Really will talk to us about everything from prevention to modifiable risk factors to genetic factors and testing that they have. I'm really excited to see what both of them have to offer.
And as clinical cardiologists,
Yes.
They speak our language. So
Yes.
They're going to talk about young patients, what they should worry about with cardiology perspective. So without any further ado, let's bring them on board and let's talk to them. We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJ Barnabas Health. Let's be healthy together.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place. And I'm here with my co-host, Dr. Kothari.
Hello, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And today we have with us Dr. Mark Katz, a cardiologist. I'm very excited to have you. Welcome. Can you tell us more about yourself?
Yeah, thank you for having me. My name is Dr. Mark Katz. I'm a non-invasive cardiologist at Jersey City Medical Center. I have offices in Hoboken and Bayonne. I have partners in interventional cardiology, and I work closely with my colleagues in electrophysiology, heart failure, and other vascular surgeons, cardiothoracic surgeons. I often see patients for preventative cardiology to hopefully keep them out of my office, and also for routine cardiac issues, including heart failure, abnormal heart rhythms, high cholesterol, high blood pressure. And on the side, I also like to create educational YouTube videos for my patients so that they can extend the time that we have in the office to get a little bit more information or revisit what we talked about.
Excellent. So explain to me a little bit like what does a clinical cardiologist do? In other words, it's a little bit different than interventional cardiologists. Clinical cardiology, to me, is a little bit more of what we do, so the bridge that between, the patients needing the procedure, what kind of diseases, what do you typically deal with?
Certainly. A lot of my patients are being seen for kind of routine issues where a primary care physician or an internist sent them for an expert opinion on chest pain, palpitations, high blood pressure management. And a lot of my patients are those who have already had heart surgery, valve issues, abnormal heart rhythms like atrial fibrillation. And although my friends jokingly will say that I, quote unquote, don't do anything, but I will be the person who manages patients before a procedure or surgery, or will call in my even more specialized colleagues to help us better care for our patient, and then also follow them after those procedures and surgeries.
It's fantastic. And you talk about patients. I know you take care of a lot of young patients. What are the common risk factors for heart disease in young people?
I think the risk factors for heart disease in young people are the same for adults. Those who have inherited things that we cannot change, like our genetic predisposition to developing certain conditions, if you have a strong family history of certain conditions, as well as modifiable risk factors that your doctors probably yelled at you before about. Things like if you smoke, how sedentary or active you are, the type of diet that you eat, including the various foods that you have, how much saturated fat or how much sodium you're having in patients who have high blood pressure, for instance. So a lot of the conditions that might affect young individuals are the same that we'll talk about with our adult patients.
But the younger individuals actually have a little bit of a different twist because especially, for example, like hypertension, you don't think of a young person as, for example, having high blood pressure, say a 20-something-year-old. So, there is, I guess, something more to just, checking their blood pressure when they come and see you. You're looking for these other diseases, so to speak. So.
Certainly. I think with most cardiac conditions, the issue is compounding interest. The longer you have a condition and the more uncontrolled it is, the higher your long-term risk of developing some of those more serious cardiac complications like a heart attack, stroke, kidney issues. So when we see a young individual who has high blood pressure, for instance, we want to make sure, is there something else that's causing this? And a lot of times we do always want to treat the underlying cause. I know it's not as simple as a doctor telling someone to lose weight or eat right, but sometimes treating those underlying issues or habits can sometimes make a dramatic improvement in things like your blood pressure control. So a lot of times it is part of that preventative aspect of our job, especially in young individuals, and making sure that we're not missing anything. For instance, if you're having obstructive sleep apnea in adults, or other conditions that may require a little extra testing.
It's kind of funny because the young individuals are very similar to the elderly individuals. Young individuals also have a lot of arrhythmia problems, correct?
Certainly, I see a lot of patients with palpitations, and thankfully for the most part, palpitations or the abnormal sensation of your heart beating can be completely normal. But I like to perform a lot of basic testing that gives us a little bit more information for patients who have various symptoms or possibly new diagnoses.
But let's step back to the patient who doesn't even, I'm an emergency room doctor, so I see many patients that never seen any other doctor, never had a screening. So what kind of screening test would you give someone who thinks, I'm healthy, I don't really need to see a doctor, I don't need to see a cardiologist, that's something my father would do. What kind of screening test would you offer people that don't have any access to healthcare, really?
That's a great question, and all adults, whether you're 18 years old or 65 years old, should at least be screened for high blood pressure and high cholesterol. A lot of the issues with cardiac conditions is that they're silent. They don't have any explicit symptoms. Someone can have high blood pressure, have high cholesterol, and it can be simmering over time and waiting to manifest over many years. So every adult should be screened for high blood pressure, whether it's at the clinic or some type of medical setting, as well as getting basic blood work to make sure that we're not missing anything obvious, like inherited high cholesterol levels.
Yeah, we're going to take a quick break and we're going to be right back because I do want to go into some of the diagnostic testing, because again, this is really your bread and butter, so to speak, and I want to get back. So we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place, and I'm here today with my co-host, Dr. Akunyili.
Hi, everyone. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health, and we're here today with Dr. Mark Katz. Welcome back.
Thank you for having me.
Yeah, so tell us more about these preventive screening tests, especially for younger individuals, not just the older, but the younger screening tests. Yeah.
Certainly. So some of the basic ones are, again, checking to see if you have high blood pressure and some basic blood work to look for cholesterol and other basic blood work.
And what about things like, for example, in a young patient, do you do an EKG? Do you order a stress test, echo? Talk to us a little bit about that. Yeah.
Certainly. I think it's reasonable to always get a EKG on patients, especially if they're having symptoms, to try and figure out if there's something going on beneath the surface. For the most part within cardiology, I try not to order more tests than are needed. I don't want to order an unnecessary test that leads to another unnecessary test and leads us down that spiral. So in the appropriate patients, symptoms often can lead the way on what we order. It's hard to give a specific example of what we always do, but some of the most common tests that we use are an EKG, which is a surface electrical fingerprint of the heart, which gives us a snapshot in time. If we want to see an extended version of that, we can use any type of Holter monitor for a day or up to 2 weeks, and sometimes an implantable device that can stay there for up to 3 years. Another version of a test that looks at how the heart is squeezing, relaxing, and valves opening and closing is an echocardiogram or an ultrasound of the heart, which gives us a little bit more detail than what the surface EKG or electrocardiogram gives. And in the right patients, sometimes we do need to perform some type of physiologic stress testing, where we get your heart rate up to see if your heart is able to keep up with the metabolic demands of your body, to evaluate for a variety of abnormal heart rhythms, or if there's a serious blockage in the arteries of the heart.
Very interesting, very interesting. So let's delve into EKG, because I get this question asked a lot. You know, what exactly is an EKG? Yes, it records the electrical impulses of your heart, but what do you see? What is the power of the EKG?
An EKG is a good snapshot in time. It tells us what's going on right now. So in the right setting, it can give us a baseline to understand, do you maybe have a sign or a clue that maybe you have underlying high blood pressure? We can see certain clues with that. Can make sure that we're in the right rhythm or a normal sinus rhythm. And in certain emergent conditions, we can find out, are you having some dangerous or life-threatening condition right this second?
So I think the EKG is a good segue to heart palpitation. One of the most common things people go to a primary care doctor, to the emergency rooms. I'm having palpitations. Tell us, what does that mean in a generic sense? And what would you advise somebody having heart palpitations, and who should they see in addition to seeing their primary care doctor or instead of?
Certainly. I'm always happy to see patients for palpitations, which are the abnormal sensation of your heart beating. I'd say the strong majority of the time, it is your normal heartbeat, and there's nothing crazy abnormal going on. But before I say that everything looks hunky-dory, I like to at least get a few extra tests, like a Holter to see what's going on when you're feeling those symptoms, an echo to make sure there's no primary cardiac issue happening that we can't see beneath the surface. And I think it's always reasonable that if a patient wants, or a primary care doctor wants help in trying to find out what's going on, that they see a cardiologist. As a cardiologist, I'm always happy to blame it just on anxiety or stress. Certainly, if it's happening certainly if your anxiety or stress is so poorly controlled that you're seeing a cardiologist, it's important that we address it. But I'm also always relieved when we don't find anything abnormal beneath the surface.
So can you detect, say, coronary artery disease, say, with an ultrasound, with an echo?
Yes and no. We can perform an exercise stress test and couple it with an echo, so we can look to see if there's abnormal wall motion on the echo when you're after you're exercising. But an echo is just like an EKG, where it's a snapshot in time. If you see that there's abnormal wall motion on an echo, it might mean that there's already been damage to the heart. If there's narrowing causing your symptoms, then we might not see abnormalities on a baseline echo, just like we might not see abnormalities on an EKG. That's where that stress testing, or sometimes anatomical imaging, might be more useful to figure out what's going on.
So this is really kind of like the importance really of the clinical cardiologist, because they really put all these different pieces together. You know, the interpretation of the EKG, because your EKG could be completely normal and you can have all the heart disease in the world, or you can have a really ugly looking EKG and yet you do not, so to speak. And then every modality kind of gives you a little bit of that picture, so to speak. But again, you still have to rely on the clinical information that the patient gives you, which I think is very unique to the clinical cardiologist, because you really get to sit there and listen to the story, know the medications, and then know when to go to the next step. If they need intervention, then you speak to your colleagues. If they need electrophysiology, then you speak to them. But it's just fabulous, everything that you guys do. It's very, very needed, because a lot of the cardiologists are becoming interventionalists, and there's no one to really practice the art anymore, so to speak. So it's really
well,
important.
and we talk about access to care. It's important to have cardiologists like you in our community. And before we go, just 10 seconds, tell us about the Hoboken location and what opportunities we have for our community to come there and the care they can receive.
Certainly. So the care that you get at our Hoboken office is going to be the same that you get anywhere at any of our locations, where you're able to see a cardiologist at almost little to no extra time needed to get in to see us. where we're able to order and do all the tests needed. Certainly, sometimes we don't have enough time, just like today, to go over all that information. So I certainly have more educational videos available on my YouTube channel at Mark Katz, MD. And I go into much more detail on topics like we discussed today, palpitations, high blood pressure, and other things that I believe my colleague will be discussing, like a coronary artery calcium score.
Well, we're very happy to have you at RWJ Barnabas Health, let me tell you. But thank you for coming, and we'll be right back.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Welcome back. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health. And today we have Dr. Janish Kothari with us. Welcome.
Pleasure to be here. Thank you for having me.
Of course. So tell the audience more about yourself.
Well, I'm the newest addition of cardiology to Jersey City Medical Center, and pleasure to be here. I just recently finished my fellowship, and like I said, I'm enjoying my time here. Everybody's made it so hospitable, and I'm loving the team that I'm working with.
And you're from Jersey City,
yes,
right?
Yes, I am. Born and raised.
Well, welcome home. So tell us, you're newest to this group. I know you have a real interest in preventative cardiology. So can you tell us more about your general interest in preventative cardiology?
Well, I think preventive cardiology is an important field because the whole idea is to prevent that first heart attack and that stroke. And I think it goes a little bit beyond that because we obviously have patients that have already been afflicted with disease. So the idea is to prevent that second heart attack or that second stroke and sort of, do my part to reduce the healthcare costs and the burden of disease on these patients.
Very interesting. And tell us a little bit more about some of the, say, preventive measures that you recommend to your patients, depending on their age group and the risk factors.
So as you're saying, depending on the age group, there's a different variety of conditions that can be affected by them. When I have younger patients, taking a thorough history and performing a thorough physical exam and understanding what their family history is and putting them into categories of risk modifiers, depending on their genetics and things along those lines, kind of steer me in the right way. Understanding underlying conditions that patients already have. Have they had a prior heart attack? Have they had a prior stroke? And then if they're coming to my office with new symptoms, that helps me decide which testing or things that I need to get done as well.
And then tell us a little bit also about, say, for example, a lot of the modalities, the EKG, the echocardiogram. How does that play with what you do, and especially your relationship with primary care? Because that's got to be very integral for you to be able to communicate these same diseases that we're both actually treating.
Absolutely. So I think the beauty about primary care is that they play goalkeeper, right? And anytime the puck gets in, I get them in my office, And when the primary care has some challenges, try to figure out why a patient might be short of breath or why they might be having chest pain. That's kind of when my mental ticker starts going. Do I need to look for coronary disease? Does that even make sense in a younger patient versus a older patient? One thing that I do with preventive cardiology is looking at pre-test probability of disease versus the post-test probability of disease. We can't just willy-nilly order tests on everybody because the worst thing you can do in medicine is have a false positive, because when that happens, you send people down this, pathway of unnecessary testing. It increases the cost of healthcare. And what I think is even more important than that is a mental and physical burden on patients, letting them think that they have disease until we actually figure out that they don't have anything.
So what of patients that have a genetic predisposition? What of that subset of patients? Do you find that out just by taking the history, and how do you decide what tests and what kind of common genetic illnesses do you see in your clinic?
I think that's a great question. It's something that I spend actually quite a bit of time with the patients in the office. I think the first thing I need to let them know is that sometimes their conditions aren't in their control. I have some patients in the young quartiles that they have high blood pressure, cholesterol, and diabetes issues, but they assure me, Doc, I don't do drugs, I don't smoke, I don't alcohol in moderation, I eat right, I'm not overweight. Why can't I control this? And I think that's where I kind of bring in that idea that sometimes you have cards that you're dealt, and blame your parents or blame your grandparents, because genetics is something that you can't control. And that's what we consider to be a non-modifiable risk factors. So allowing patients to know what that means and understanding where they lie in that spectrum and sharing it with their healthcare providers like your primary care doctors and myself, it helps me appropriately risk stratify them. For example, if I have a patient whose father had an MI at 35 or a stroke at 35, that's unusual. And that significantly enhances their risk of developing premature disease. And I'm a lot more aggressive with that patient than I would be with somebody that doesn't have that kind of history.
And then MI is a heart attack.
Heart attack,
right?
Sorry about that, yes.
No.
And again, we read a lot of the recent data, a lot of the studies, and they talk about the standard of care, for example, the lipid, the high blood pressure, the weight, et cetera, et cetera. I'm sure that's the heart of basically what you do with a lot of your patients.
Yeah, absolutely. Basic screening, like checking blood pressure, cholesterol levels, other risk modifiers like diabetes, getting a social history, that's incredibly important. Smoking is one of the biggest risk factors and contributors to cardiovascular disease. So getting a thorough history and physical is absolutely paramount in managing these patients.
Yeah, a lot of patients don't realize, especially the past medical history, genetically, for example, premature coronary artery disease is probably one of the biggest risk factors. For example, I have that in my history. I got lucky, I got more of my mom's genes, but my brother got the short end of the stick and ended up actually with my dad's genes. And he's basically inoperable in his early 50s and already had a couple strokes and whatnot. So I think it's very important, especially the role that you guys play, coordinating all this with primary care.
Absolutely, absolutely.
All right, we'll take a break. We'll be right back.
Comprehensive healthcare is here, here, and here. RWJ Barnabas Health is healing, enhancing, and investing in Hudson County with its 2 newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Welcome back, everyone. I'm Dr. Ije Akunyili, Chief Medical Officer, Jersey City Medical Center, a facility of RWJ Barnabas Health. I'm here with my co-host.
Hi, I'm Dr. Angel Lazo. I'm with RWJ Barnabas Health at Exchange Place. And we're here today with Dr. Kothari, who's talking to us about the cardiology and the young patient and preventive studies and so on and so forth. So tell us a little bit more about the modalities that we were talking about.
So there's a vast array of things that you can do. It ranges from a simple EKG to as invasive as doing a coronary angiogram, and there's stuff all the way in between. Stress testing, simply putting a patient on a treadmill, looking at what their EKG is doing. Now, some people don't have the means of being able to exercise on a treadmill because, arthritic pain, hip replacement issues, and things like that. So how do we figure out if there's issues going on with these patients? So we can kind of escalate that by adding an imaging component with an ultrasound or a more accurate type of imaging with CAT scans and MRIs and even nuclear stress testing. So there's a vast array of things. And the way we decide on imaging modality depends on individual patient risk factors and certain baseline characteristics that may or may not reduce the sensitivity of these studies. Because let's face it, not every study is absolutely perfect. So you want to make sure you're ordering the right thing in the right patient population.
So on a very basic level, do you encourage your patients before sort of this more advanced studies to have wearables where they check their heart rate, how much sleep they're getting, just from a very preventative level? Are you looking at that?
I think it depends on individual patient characteristics. If they're having palpitations and things along those lines, then sure, a monitor like a Holter monitor or a mobile cardiac monitor are paramount as well, and that helps us get the quite a bit of information that we would need. Now, if they're talking to me about chest pain, I need to parse out what kind of chest pain they're having, and am I considering it to be a classical anginal type of chest pain that I see as a cardiologist, or is it non-cardiac chest pain? So, like I said, you don't want to order the wrong test on the wrong patient.
Now, you're going to be at the Hoboken site as well?
Yes, I will be.
Great. So tell us a little bit about what's going on there and why you're so excited about that site.
Well, the office is absolutely beautiful. It's got nice artwork. The lighting's great. The staff is awesome, and the location is beautiful, right? Growing up in Jersey City, Hoboken is a place that I used to go to all the time. That actually used to be a New York sports club, and now that's the same facility that I work in.
I did not know that.
It's awesome. So we offer quite a bit of testing. There's so many different specialties there, ranging from radiology, orthopedics, OBGYN, and we have a collaborative kind of system there. I often get patients that see the primary care across the room, and then they send them right across to me because they have an abnormal EKG, and we're able to offer these patients, collaborative and comprehensive care right on the spot.
Talking of the care you give, I know it's, we have the physicians, but can you tell us more about the entire care team, for example, in a place like Hoboken?
Right. So when I said that, I'm the newest member here, one of the first things that I realized how collaborative all of our teams are. We have different specialists across cardiac specialties. And like I said, we have specialists across various fields in healthcare. And, we share a similar electronic medical record so we can kind of see what each other's thought process is. And it's truly a community. I can pick up the phone and, phone a friend, so to speak, and ask any questions that I want. And everybody's so eager to help one another.
But you're an integral part of that whole service line that they have in cardiology, being a clinical cardiologist, because you really coordinate the care between the primary and referring and then your colleagues, whether it's EP, whether it's interventional cardiology with the structural heart program that you guys have. So it's really an asset actually to have you guys there in Hoboken.
Yeah, I appreciate that.
So,
talking about heart disease, and I know I just want to step back. I know you said you have a lot of testing. Do you have specific biomarkers that you have to usually test for, especially younger patients or people with a genetic predisposition to disease?
Yeah, that's a great question. And that's one of the reasons why I love the field of cardiology, because it's constantly evolving, Some basic lab work that we always get on patients are, lipid panel, checking their A1C, fasting blood glucose, electrolytes. And there's even some more novel markers that are still in testing. And in the later phase of the trials, we have, elevated homocysteine levels, lipoprotein A, lipoprotein B, lipoprotein E. And who knows, as the studies kind of evolve and the understanding of these biomarkers continues to evolve, we may even have targeted therapies that don't necessarily exist right now. Because I often get patients that have a history of a heart disease, a heart attack or a stroke, and they're well controlled, and all those biomarkers are well controlled that we are aware of right now, but then they come back in with another disease. So is there something that we're missing? Is there something that the science hasn't, shed light on yet? So I'm excited to see where that goes and try to be at the forefront of that, because this is what we do. This is what we practice.
yeah, and the neat part, especially for you guys, is, according to the prevalence of disease, heart disease is the number one killer. 800,000 heart attacks every year, 800,000 strokes. 600,000 are actually first-time heart attacks and first-time strokes, which is crazy. But with a lot of these diseases, it's also the modality, the medical component of it. A lot of the medications are cardioprotective, for example, like the GLP-1 class, SGLT2. So it's very interesting, very good time to actually be in cardiology and also be in medicine right now. Thank you so much for coming.
Yeah.
Really appreciate you coming, and we're hoping to have you back.
Thank you very much.
So,
I look forward to that.
We're going to go to break, and we'll be right back.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Well, that was a treat. Welcome back, everyone. And it was such a treat to talk to Dr. Katz and Dr. Kothari. And they really showed a lot about what they do in preventative cardiology and the access that this community has to world-class cardiology.
Yeah, and we got an opportunity to talk to them about, what they do for younger patients and just the clinical cardiology and the right there at that new hub in Hoboken. So we want to really thank them for coming, and we're going to have them back on board again.
We'll be back next week. Thanks for watching.
Thank you.